Hey there, it's Dr. Jim. Thank you for stopping by. My topic today is a really interesting one. It's actually really cool. Alzheimer's disease and virtual reality. Let me give you a second. Put them together. Alzheimer's disease and virtual reality. What do you come up with? A few short years ago, no one would put those words together in a sentence. But amazingly, today we can. According to some researchers, virtual reality may be more effective at diagnosing Alzheimer's disease than the traditional cognitive tests that have been used for decades. This is fascinating because medicine has considered cognitive testing the gold standard of diagnostics. How does virtual reality assist in diagnosis, and why is it better than standard testing? It's all about getting lost. Think about that. As a young boy, I remember my grandfather, John, who back then was diagnosed with senile dementia. And it was a common diagnosis back in the 70s, 80s. He would leave the house and he would walk for miles and miles. And my grandmother was not aware that her husband got up and left the house. So my grandfather would wander far away from their home and he would become lost. And the police would have to look for him and bring him home. Okay, today we know that confusion, disorientation, wandering, and elopement, or simply getting lost, are normal symptoms and behaviors associated with Alzheimer's disease. The problem with traditional cognitive tests that are performed using a pen and paper is that they don't identify difficulties like navigating an environment. This is where virtual reality can help. In a study led by Dennis Chan, individuals diagnosed with mild cognitive impairment used a headset to navigate a simulated environment. As Dr. Chan and his team hypothesized, they had difficulties and performed poorly. This study also revealed two important observations. First, those individuals with mild cognitive impairment and positive cerebrospinal fluid markers indicative of Alzheimer's disease performed the virtual reality exercise worse than their counterparts with negative cerebrospinal fluid markers who were at a lower risk of developing Alzheimer's disease. Second, the virtual reality exercise was better at differentiating between the low and high risk cognitive impairment participants than traditional tests currently being used to diagnose Alzheimer's disease. So, as a gerontologist, I have hoped for better methods of early detection for neurodegenerative disorders like Alzheimer's disease. Catching it earlier can mean treating symptoms sooner, possibly delaying or slowing down progression, and improving quality of life. Those are important things. If this can be achieved through the use of virtual reality testing, then let's replace the pen and paper evaluation with a good use of technology. See you later. I'm Dr. Jim.